Welcome back to the Balance Boss Mom podcast. I'm your host, Erika, and today we are having one of the most incredible guests on my podcast. Her name is Dr. Charisse Balance, and we are going to just dive into this awesome conversation that is going to be very empowering. For those that are listening, if you are having a rough day or just need encouragement for today, just let me know in the comments, and I will definitely reassure you about this podcast for today. But I want to welcome Dr. Balance for this afternoon. How are you today?
I'm just making through the day. Making it through the day, man. My kids are outside, but this is why we're called the Balanced Moms.
Yes, this is why we're called Balance Boss Moms. Yes, so I want to start diving into a little bit about your background.
Okay.
Of course, I know you're a pelvic, is it pelvic PT? Is that
Yeah,
correct?
pelvic therapist.
Perfect. Okay. I'm getting everything mixed up here. Sometimes I say PT, sometimes I say
I'm a
pelvic.
PT. I'm a physical therapist and I specialize in pelvic health. I primarily use like myofascial release as my main modality, and I also teach yoga.
Okay,
So
so
I
you're gonna have to teach me some yoga because I can stand, but
great warrior Tadasana. That's
that's
great.
that's just about it. I like yoga. I do. But I can stand, but I can't balance yet.
That's okay. The yoga is not the pose; it's the residue that the pose leaves in your body.
Well, I need to learn that. Unfortunately, my balance is way off as I am a mom. All right, see, I'm laughing too much. I'm just chatting away. So tell me a little bit about your profession.
Well, like as a pelvic therapist or as a
Yeah,
mom. I don't know which one. Right now, I just feel
I
like,
think I think we could start with the pelvic therapist first, and then we can gear into being a mom because we are bosses.
yeah, man. Well, so first off, let me start off by saying thank you for having me here. Um, I'm 3.5 months postpartum, so I'm like all this information is fresh in my body. Um, and it's partially why I do what I do, as a pelvic PT.
Hmm.
Because that's the whole people ask why I got into it. It's because of I'm a mom. And I'm like, who's going to advocate for me? Because I'm not going to know any different. So
I
that's
like that you said that. Who is going to advocate for you? Because you need somebody to advocate for not only yourself, but everyone else. So,
yeah. Because I'm only going to be told like what's told to you from the professionals is their viewpoint. That's their lens, right? And so
hmm.
it's to know like what your options are, what your choices are, what's real, what's not real.
Hi, hello. Are you making a guest appearance on here?
Yeah,
Are
yeah.
you the first boss mom baby on here?
You like it. You like that.
You like it. Hello.
So that's kind of what I do. I see myself as I'm gonna feed her. I'm a guide. I'm a
I like
guide
it.
to help people better understand their bodies and
Hmm.
heal. I think that people like the body is genius. There's a lot of wisdom held in the body. I don't think that anything is linear. Um, and I think that if we give the body the opportunity to heal, it will heal.
Hmm.
Um, and I like to empower pregnant and postpartum folks in that space.
I like that because not everybody knows a lot about how their body expands or what their body does in pregnancy. And I feel like a lot of people sometimes just don't really know what to do in that stance, like the beginning of their pregnancy, you know?
Hmm. Yeah, like is this normal? I'm feeling like my labia are swollen. Is that normal? I'm feeling like I have to pee all the time in my third trimester. Now I have incontinence. I'm like, no, don't trip. That's normal. How could it not be normal? You have your little tiny bladder with a big ass baby on top of it. It's called physics. So
Especially the peeing, because the peeing, I couldn't stand the peeing. Like the constant peeing, I mean, I get that because there's a baby growing inside of you. And so if they're peeing, you gotta pee. But I've always wondered about that. Okay, that is a whole nother topic for another day. Anyways, I've always wondered about that because I'm like, how is a baby peeing and then they make you pee, but
It's the
Cool.
pressure from the baby. Oh man, where are my organs? I usually have a bunch of stuff here, but it's in my office. Oh no, here. But I'm holding a baby, so I'll show you later. But
Yes.
did you know that the baby's pee is actually what makes up the amniotic fluid that the baby floats in? It's floating in its own pee. So it's not necessary. I know, right? Look at your face. It's not necessarily the baby's peeing that makes you pee. It's the pressure of the baby as it grows on your bladder that makes you pee. Isn't that a trip? I know, right? You just don't know what you don't know.
I don't know. I don't tell me something else that I didn't know because I didn't know that. Now I'm scared. Now I'm like worried,
Oh,
which is pretty interesting. In retrospect, kind of a little bit about your practice in helping embody like the giving birth after pregnancy. What are some of the things that we can look forward and like with our bodies, so to speak?
what are you doing with your sphincters? That's what I like to ask people. What are you
You
doing with your sphincter right now, Erica?
oh,
You know,
you're
you're
asking me
feeling
a question with a question.
you want to
Okay. Um, because I got paused there. So I was like, wait, there's a question? Okay. So I'm not really necessarily doing anything with that right now. I'm kind of at a standstill, leveling out, kind of a standstill. So
Have you felt what's going on in your sphincters? You maybe like put your finger on the anus. Just feel. Maybe everyone listening, why don't you just feel? Is this normal to me? This is just normal talk to me. So I know this is weird to some
it's
people.
not weird because I'm interested. So and I'm invested because I need to be. You have to be invested with your body after giving birth
Right.
because
You're telling me.
I've had a child 7 years ago. So there's probably all different types of things going on with my body after 7 years later. Um, but I've never done the finger on the no. Mm-mm.
So I asked that because when you breathe, there is a normal range of motion of your pelvic floor,
Mm-hmm.
right? So when you breathe, the pelvic floor descends and releases and relaxes on the inhale. And on the exhale, everything just kind of to
Like comes
rest.
back to gravity.
Comes back to rest, right?
It
And then
like it.
when you do like a contraction,
Mm-hmm.
then it comes like into your body, right? So there's like a range of motion. If you think of of the pelvic floor as your bicep, right? Your
Okay.
bicep can lengthen, right? Oh, sorry, it shortens, it comes to rest, and then it lengthens, right? You need this
Mm-hmm.
whole range of motion for a muscle, any muscle, to work optimally. And the pelvic floor muscles just happen to be down there, right? So if we're
Mm-hmm.
held up and tight, what's going to happen when a baby has to come down through there, right? And or if we read like I read in my right, because I just had her a couple months ago, and in my app, like I was telling you earlier, it was like 20 something weeks, and the app was telling me to start doing pelvic floor contraction, like pelvic floor exercises to prepare for birth. I'm like, what kind of exercise are you talking about?
Right. So what kind of exercises can you do?
Oh my God, look at I'm hell sweating. Okay, sorry. These are postpartum sweats.
No, you're fine. You're fine. You're fine.
These are normal physiological reactions after pregnancy, people. Okay.
After pregnancy, yes, because postpartum comes in many, many different forms. I'm just saying.
Yeah.
It does. It,
And
it
let's
comes in, but you can have mood swings. You can be eating. There's a lot of different anxiety and depression, which I did go over with that with Dr. E. We did talk about that a little bit
good.
about the anxiety and the postpartum depression because did I? Yeah, no. I did dealt with the depression, the postpartum depression, and I didn't recognize the signs until after I went to the doctor.
It's commonly overlooked
And why is it often, I wonder why it's not often looked at more,
because it's common but not normal, like a lot of things.
which is true. That is true. So I'm trying to see what are some of your favorite exercises to do?
Um, in preparing for birth.
Hmm. Well, just overall, like yoga, birth.
Oh, I love yoga. I mean, that's my business name, Fizzy Yoga. Because I can't separate the physiotherapy and the yoga. I mean, it's like one and the same to me because
Mm-hmm.
I don't know, I just integrate it um, with each other. So my favorite exercise is probably mm, trying to sit in a quiet room and breathe and notice. That's yoga.
That's yoga. Mm-hmm.
Yoga. Um, sorry, I have to tab.
No, you're good. You're fine.
And well, with respect to birth prep, embodied birth prep, I think is what my favorite thing to do to work with people on. And it's not like the typical birth prep where it's like, let's stretch out your vagina and like, prepare
Mm-hmm.
you for birth. It's more, I like to word it more like, let's help your body remember what it's already capable of.
I like
Um,
that.
because um
It's kind of like reconnecting with your body, which is
exactly.
important.
Reconnecting with your body's like innate capability of birthing a human.
Mm-hmm.
And like I'm not right. I know Isla through my birth canal. But I think the part of the yoga that is helpful in birthing
Mm-hmm.
is is grounding, right? It's being like
Mm-hmm.
let me feeling all these sensations, but remembering from like normal physiological birth, these sensations are purposeful
Mm-hmm.
and they're intense. They're intense as hell, right?
Mm-hmm.
And with purpose. And how can you anchor in your breath and in your nervous system to to come through those contractions, right? Because it's one contraction at a time. And
Mm-hmm.
how do we not like freak out and tighten the pelvic floor? Because, right, like I was saying earlier, the pelvic floor doesn't need to be tight. It needs to get out the way, just like that song, right?
Mm-hmm.
Get
Yep.
out the way, pelvic floor for the baby.
Mm-hmm.
Um, it needs to yield, it needs to receive the baby as it's coming down and through. And so I think what I really like doing is helping people remember that they're capable of that. And when people are able to feel like, oh, this is what lengthening the pelvic floor feels like. This is what kind of doing like a reverse Kegel of like pushing down and out instead of pulling up and in feels like. Um, then I don't know, that's really satisfying to me. That didn't answer your question at all.
I like that though. I mean, although the question, I mean, we don't have to do a question based over here. We're just having a conversation. So I know that there is a lot of, I know reconnection is important,
Yes.
to reconnect to your body. But what happens when you ignore, like when there's a disconnect with your body?
Mhm. Well, your body, like I said earlier, your body is like so wise, and your body's always communicating with you.
Mm-hmm.
It's always telling you signals, right?
Mm-hmm.
But it's when we start ignoring those signals that like pain and then chronic pain starts. I mean, outside of specializing in pelvic health, whoa, girl, she's so why is she rolling?
It's happening.
No. Outside of specializing in pelvic health, I first started my PT career in chronic pain,
Mm-hmm.
right? And with chronic pain, is that like sure you can have a traumatic event and that causes pain, right? But
Mm-hmm.
sometimes people like completely heal from that, and don't have symptoms anymore, or they just keep on having symptoms like years and
Mm-hmm.
years and years down the line. And why is that? And so it's like I said, your body is wise, and if you don't listen to your body's signals, like
Mm-hmm.
if you don't sleep when you're tired, and instead you're like, "Let me go get a
That's me.
coffee." That's me too. I'm not gonna lie.
That's me.
Get a coffee to power through, right? Instead of listening to your body, or when you're like, "Oh, that like little twinge in my shoulder, that's bothering me, but I have to do this for whatever, so I'm gonna
Mm-hmm.
keep going through." Over time, mm, that's going to cause something, right? So I think
Mm-hmm.
being embodied and listening to your body's cues is so important in prevention, right? And minimizing things
Right.
from getting worse. And that's my most favorite way of working with people is like because coming from the chronic pain space,
Mm-hmm.
so much of that was like, how can this could have been, I think she's pooping. So
I
much of
think
that,
she's talking. She's saying, "Yeah, I'm
yeah,
pooping."
right. Um, with the chronic pain patients, so much of that could have been prevented,
Mm-hmm.
had they listened to those little tiny cues. But I think it's not their fault. It might have been a circumstance, but also like our society just glorifies so much like go 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 do do do.
Mm-hmm. That's what I was
Like,
talking about with Dr. E. We were talking about how our society is so focused on work, 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 and getting back after 6 weeks, where we don't have the time to focus back on ourselves in 6 weeks. It's just kind of like, okay, here's the 6 weeks, and then here's life. Of course, there's no
six
book
weeks,
by it.
it's so crazy. It's like, and you have a kid. It's like after 6 weeks, you're just getting your maybe a little bit of sleep.
Maybe just a little bit of sleep, not so much. And that's the frustrating part, because I wish, like I was talking to Dr. E, where she was saying that some places, I do believe we were talking about it, where some places they check the mother like after 2 weeks. And I
I
think
mean,
that should be the best thing to do, is get the mother checked after 2 weeks instead of waiting 6 weeks.
no, 6 weeks is ridiculous. 6 weeks. I'm. It all depends on which model of care you have. Like I had a
Mm-hmm.
home birth for this baby and my middle baby, and they check you the day
Oh,
after.
God. You
What?
home
Home
birth?
birth? Yeah.
Yes.
Yeah. Yeah. This is another episode, girl. We
Do you
we gotta.
guys? You had a home?
Yeah. I mean, I support wherever anybody feels the
I mean,
safest.
we do. What?
That's just where I felt the safest. I really love my midwife.
Hmm.
Did her with my life, still do, and just felt more comfortable at home. And so she
Man, if
came,
I could have had a home birth, I would have been watching TV.
right? That's
I'm
what
just
my husband
saying,
said. Like after we gave
just
birth,
putting
we're
it
like,
out there.
so much better than sleeping on that
On
couch.
that bed, on the couch that they give you, yeah. I like
Um,
I think home births should be more normalized, to be honest with you.
yeah.
This is not
They,
often talked about. You only hear about, like, with the home births, you only hear like, hey, I mean, there are home births, but nobody ever really explain about what a home birth is. And then they were like, okay, well, you can just do a C-section or vaginal.
no. See, this is what kills me is that people aren't told what their options are. I had a
Hmm.
client that had two she had two cesareans and was like, well, she had a cesarean with her first and then was told she had to have a cesarean with her second. So then she had a third and was like, learned that she could have a home birth. And I was there and I supported her through it. And like she effing rocked it. She did amazing.
That's awesome.
Um, but it's like she wouldn't have known, if she didn't hear from, I don't know how she found out, but um, that, it informed consent, true informed consent is like so important, right, for patients, so you really know like what are all your options so you can make your own decision.
Mm-hmm.
um but yeah, so there's midwives that are in the hospital. Those are nurse midwives, and then there's out of hospital midwives, and those are usually like I forgot what their credential is, but they're out of hospital midwives, and they usually
Mm-hmm.
do home birth. And to do a home birth, you have to qualify for home birth. So it can't be a complicated pregnancy,
Mm.
all
I,
that stuff. And if it's an uncomplicated pregnancy, you can have a home birth. Um,
I didn't even know you
I
had to be qualified for home births.
Yeah, but that's the thing. People get freaked out about like what about if you need medical intervention and all this
Yeah.
stuff? First off, your midwife is not going to say that it's okay to have a home birth
Mm-hmm.
if you don't check all the boxes. Second off, they're going to send you out to the hospital way before you even need to, because they are medical professionals that are trained,
They're trained to
to
do that, and they know
monitor.
the signs and the signals for that, correct?
Absolutely. I mean, that's their job is to
That's their
deliver
job.
babies.
Mm-hmm.
That's their one job. OBs are great, and OBs are here, and thank God for them. And
Mm-hmm.
they're here, to
Right.
help in medical emergencies in birth. But not all of birth is not an emergency. It's a
No.
normal physiological process. And this is my lens from having two home births,
Mm-hmm.
but it's like undisturbed will go, I mean, as long as it's like there's no complications, an
Mm-hmm.
undisturbed birth will take its normal physiological, the process. I love to follow Betta's mother birther. Shout out to her.
Oh, I have to.
She
Okay.
follow Betta's mother birther on Instagram. I send all of my patients to her when we do birth prep
Oh.
because it's just she shows videos of normal physiological birth,
Mm-hmm.
right?
Mm-hmm.
And I think, and I encourage my clients that are doing birth prep with me to watch that because it kind of helps to it gets your nervous system used to that. The
Mm-hmm.
sounds, what you're going to see, especially if it's your first birth or first home birth, and
Oh.
what birthing person is capable of,
Mm-hmm.
you know, and it's pretty amazing. I mean, you gave birth, you're amazing.
Yeah, I gave birth. That was just traumatic. That's a traumatic birth.
Yeah,
But I mean, every birth is different.
every birth is different.
But I want to touch base about the yoga because I need to know some takeaways and some practices that I can start doing today that I
Yeah.
can yeah, because I started doing yoga, but like I stated, I started doing yoga off of YouTube.
Okay. You want to do practice now?
What practice so I don't fall.
You want, and this is the physio yoga part, right? This is how I integrate all the stuff.
Mm-hmm.
You know what Tadasana is? Tadasana is mountain pose, right? It's like
Mm-hmm.
the basis of every pose, right? In physical therapy, it's really just like normal, neutral standing. My bad.
No, you're fine.
Standing. So, she's like, am I sad or am I happy? I don't know.
I see a smile.
Okay, so here's a takeaway. Go ahead and come to standing. Are you
Like
standing?
now.
Yeah.
Oh dear.
I'm very experiential in the way I teach.
I'm scared.
If you're going to take it away, I want you to be able to feel it in your body.
Oh dear.
You ready?
Okay, I can try.
Okay. Yay, Erika. You can do it.
Okay. I am going to try. Okay. Hold on. Am I
You
standing?
got
Okay. Okay.
continue.
Yeah. Okay. I'm trying to make sure I don't knock down my daughter's bed. But I want to try. Because I want to try this. Okay.
Okay, ready?
Okay, I'm ready.
Okay.
Okay.
So jump up and down, jump up and down, jump, jump, jump. I know. What kind of yoga am I teaching, right? Jump up and down and see how you land.
Okay. Hold on. I got house shoes on. Hold on. I'm going to try. Okay. So, like this?
Just jump up and down. Yeah. Okay. Cool. Cool.
Okay.
You're good. You're good. Okay. Now, if you feel comfortable, close your eyes.
Okay.
And from there, just notice where you're putting weight in your feet. Is it more towards the front of your feet? Is it more towards the outsides or insides? Is it more
It's
towards the
like
back?
more towards like half. It's like more not towards me, away from me. It's like I'm pushing
Towards your toes?
towards my toes. Yeah.
Okay, cool. So notice as you're standing how you usually stand there,
Mm-hmm.
notice how that translates up your legs into your pelvis,
Mm-hmm.
into your rib cage, your shoulders,
Mm-hmm.
your neck. Just notice how it translates all the way up the kinetic chain
Okay.
where you're putting weight.
I feel pressure though.
Okay. So now I incur. Oh, wait. You said that you have slight scoliosis.
Right here. It's like
Which way?
right here.
Okay. Do you
That's
know what way?
where the curve is. He said it's like nine. He said I need to come back and do surgery, but eh.
Okay. When you're standing with your feet even, which foot feels like you're putting more weight in it?
My right.
Okay. So place your right foot a little bit more forward. And this is just for you because you have scoliosis.
Okay.
Just a little bit more forward. Just to the point where you feel like you're equally weight bearing in each leg.
Okay. Yep.
Better?
Mm-hmm.
Okay. So now from there,
Mm-hmm.
put most of the weight in your heels. so that you can like wiggle your toes.
Okay.
Okay.
Mm-hmm.
As you're sitting here. And then from there, stack your pelvis over your knees, your shoulders over your pelvis.
So like I'm folding.
You're not folding, you're just stacking. You're just standing straight.
You're standing straight. Okay. Okay. Woo-hoo. Okay.
You're doing great. You're doing great, Erica. You're really doing great.
Yeah.
You're doing it. Standing here,
Mm-hmm.
right? Your right foot's a little bit in front.
Mm-hmm. Yeah, it
You're
is.
feeling equal, you're feeling equal weight bearing in your feet.
Mm-hmm. Yeah,
Okay.
I can feel it.
Okay. Your hips are over your knees.
Mm-hmm.
Your shoulders are over your hips.
Mm-hmm. Because my shoulder, yep. My,
Yep,
yeah.
your ears are over your shoulders. Good.
Mhm.
Find your pubic bone and drop it. Just allow it to drop towards the earth.
So like kind of like I'm kneeling.
No, just your pubic bone. So like kind of you know cat cows? Like if you tilt your pelvis forward and tilt your pelvis back,
Mm-hmm.
just allow that front bone of your pelvis
Mm-hmm.
to drop. So don't like basically what I'm telling you is like don't tuck your tailbone.
Don't touch. Okay. So just like drop.
And to make sure you're doing this,
Mm-hmm.
just jiggle your booty a little. Just jiggle and
Mm-hmm.
make sure that your booty can jiggle.
Okay.
Make sure you're not gripping your ass. That's a yoga term.
Okay.
Don't grip your ass.
For a second. Okay. Okay.
Were
Okay.
you gripping your ass? See? Awareness. That's the yoga.
Oh God, they see this. Okay. I am learning yoga.
This is the yoga, man. This is the
Okay.
yoga. Okay.
So.
So
Okay.
that's the thing. You want booty to jiggle because you don't want to like over tuck.
Mm.
Okay.
Okay. Okay. I was, gripping. It was gripping in places. I was like, okay, different. Okay.
Right?
Okay.
But this is what I'm saying. I can't separate these things because gripping there is going to affect your pelvic floor.
Okay. So I'm gripping.
You're not gripping.
I'm
You're
not.
not gripping your butt.
I'm loose. I'm loose like a
You're
goose.
loose. Yeah. Because you know
Okay.
what happens? When your bones are stacked, you don't have
Hmm.
to over grip anything.
Okay.
All your muscles are already
I am
are
not.
supposed to be supporting you waiting. Hmm.
I'm
You
loose.
good?
Yeah. I feel good.
Okay. So from here, if you're comfortable, close your eyes or just like focus on something in the distance
Okay.
and really feel your feet rooting down into the earth and pretend and inhale here. Exhale, bring your ears towards your shoulders really, really tightly. And
Hmm.
then let go, let go, let it go. Let your shoulders go. Good. Again, inhale, bring your shoulders up towards your ears. Squeeze, 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 and let it go. Just drop it. There you go. Beautiful. And
Yay.
so this is Tadasana,
Yeah.
your first. Good job, Erica. See, you're already a yogini. Good job.
With me, people. See, I just did it.
You did. Now you're
I'm
an official yogi.
official yogi. Look, I'm doing yoga.
Yeah, but that's just standing, right? If you can
Hmm.
bring awareness to just where are you putting weight in your feet when you stand, right?
Hmm. And I did feel
That's
the weight like right like halfway in the middle of my foot, so I did feel that.
So you want to make sure you're putting most of the weight in your heel because that's the part
Mhm.
of your foot that bears weight, right?
Yeah,
If your weight is
like right here, like
you
towards
love
leg. Yeah, on my
the
left
back.
leg, on the back. When I was having it backwards, it was not backwards, but when my foot was back, I did feel the pressure.
Okay, good. Because you have scoliosis, like your neutral is going to be with your right leg a little bit more forward.
Okay,
Because when you have scoliosis, like one hip is going to be a little higher than the other in general.
and
I obviously can't see that right.
I do feel that like sometimes like it's a little. I just need to figure out with the yoga how it can help my back. Like I said, at the back, and it locks. Like it'll randomly lock,
Yeah.
and that's where it gets a little tricky for me because then I have to figure out where that all move, like how I can get it to remove. And sometimes it takes either for me to do like a hot shower or I have to do a heating pad.
Mm, yeah, sounds like those muscles might be spasming up a little sometimes.
It does that, and then like I'm either if I do have the heating pad, it helps until like the muscles kind of like relax. And then once I've relaxed, I can move, but it takes like a whole day,
Yeah.
which is scary.
Oh,
Uh-oh. Hello.
yeah, that is scary. That's my daughter. There's all kinds of things in this room. Dogs,
There's all
babies.
kinds of things going on.
Um,
So we did a takeaway. What else? Which you guys have to try yoga. If you don't try yoga, I'll tell you. But I'm trying yoga. I don't know about y'all. Anywho, um, so let's talk about being a mom.
oh yeah.
Think about being a mom.
Yeah, it's a full-time job. My husband and I were just saying like, parenting is so hard. You don't get paid for it. You can't take any breaks.
And there's
You
no
can't be
but.
like, I'm gonna clock out. There's no clocking out.
Mm-mm, you can't clock out.
See, look, I'm doing this interview and I'm not clocking out.
No,
So
she's doing something, y'all. Y'all, she's doing this amazing, and I appreciate your time for doing this because I know you had a lot of obligations, and I know. Oh, are you sneezing again? Are
that's
we
my
sneezing?
dog.
No, but I appreciate you being on this podcast because now I learned a new yoga stance.
And that's the basis of all yoga stances, of all yoga poses.
And see, when you're doing that,
Ta-da!
that is cool. And then she's doing this podcast while holding her baby. That's even a boss mom right there.
Takes one to know one.
Oh, man. If only you knew. Fast forward
Oh my
7,
God.
when they turn 7, they have opinions. Lots of them.
Wait. Can't wait.
Lots of opinions. But so how many kids do you have?
Look
A
at
lot.
your face. I know, right?
My best friend, she has 4. 4. And they say each one is a balance. Like if you have one, you need to have 2. If you have 2, get a third. If you have a third, go with the fourth. And I'm like,
Until it's a balance until when? 10? Yep.
I'm not doing not no
Oh
10.
my God.
I can't I mean props to the people that do 10, 20, 15. Props to you. I not but I don't see me ever doing that.
I mean, if that's the case, I'll be like 60 when I'm like having my other kids.
No, but
Oh man.
think about you got to think about college and are the kids going to college and then graduations 20, 20, 40, 2050. That I can't even I can't think 2040, 2050.
I know it's a trip. Remember the 90s? And now it's like 2020, almost 2026. Like it's a trip.
It's weird that now like when you look at dates, like for example the other day I was looking at 7/25, 2025, and I was like all these numbers are there's twos, a lot of twos, a lot of fives, and all I started thinking about numbers and astrology, and then I was like my mind was going elsewhere because it's all the 0, 5, 2, all of that. So a lot of numbers. Do you have any questions for
Yeah,
me? You're on my podcast.
yeah. What is the biggest takeaway that you have taken from your interviews? Like what keeps you going to interview all these people?
I think my biggest takeaway from all of the interviews that I've done, I've learned something new each time. Each time I've learned something new from each guest. And I've learned that one of the takeaways that I haven't done that I noticed that I'm starting to do a lot more is speaking up for what's right. What's right? What's the best thing to do? What's the best avenue to take? There's always some type of option that you can always take in each guest that I've learned from. Um, I've learned more about how to pay attention to my body more so. I've learned, what's another takeaway I've learned? I've learned that create boundaries with certain things that I normally haven't created boundaries before. So each takeaway has been different for me, and it's been really, really cool to interview each guest that I've interviewed. I always say, I hope you come back because it's like having a conversation with your girlfriend. And now I
Hmm.
have a lot of new girlfriends, and I'm now getting invited to places, which is pretty cool. And I don't just think this podcast is going to take a whole new landing wherever it takes. So that's my biggest
That's
takeaway.
awesome.
I just interviewed somebody
It's like,
yesterday from the UK.
oh, that's so cool. Oh, so you get to connect with people from
I'm
everywhere.
everywhere that I'm trying to connect to. And then the other thing that I want to do that I hope manifests into my podcast is I want to add men and get men's perspectives, because
Oh,
also
cool.
men's mental health is not talked about enough either. And I
Men's
want
mental
to
health.
and bring that awareness to people. And what else? Like the whole scoliosis thing. Now, a lot of people know that I have scoliosis throughout my podcast, but I want to bring more awareness about scoliosis. Not a lot of it's not talked about. A lot of these things that I'm bringing awareness to, it's not talked about enough. And I want to be able to share that even though you can be a mom, you can still have a business, or even if you're just not a mom, you still can have a business and still have friends that are moms. Don't second guess or count them out because they are mom, because that makes them feel less alone. And that's just me.
Hmm.
That's my biggest takeaway, which is pretty cool.
I appreciate you for putting this all together and having the vision for this
Oh,
balanced boss mom
you know what?
cast.
No, I mean, I don't know. I made a vision board out of this, and it has came about where I'm happy that I took the leap in having guests on my podcast, because now it opens, I'm not saying that it's not opening doors, but it's creating a space where there's moms out there that are really don't talk the things that they go through, and they look to listen to a podcast where people bring awareness and talk about things. And so if I can make that difference, then I'm happy to do so. And people might hate me for it. So what?
Haters are gonna hate. There's always gonna be haters.
No, there's always going to be haters. But in the end, it also shows my daughter that you can make a dream possible. You don't just have to limit yourself to one thing. You don't have to be that violinist where you were 4 or 5 years old and, like myself, was a violinist and played it since I was 4. And that was my first dream. That was initiated initially. I'm saying all different words. Anyways, was my first dream was to be a violinist. And then got into being in the medical field, and I fell in love with that, which I'm still in love with the medical field. I'm getting my bachelor's in administrations, and want to be able to help more health. Well, I want to help in the mental health space a little bit more, but I haven't really out just yet. I've talked about it to my mom about the whole mental health and healthcare administration. So she told me like really do a deep dive before I gear into that kind of space. But initially, once I graduate, I do want to have my own med spa.
Med spa?
Hmm.
Nice.
And the biggest goal that I want to have with that spa is I want to bring a diversity of doctors, or either if you have experience physical therapy, if you experience massage therapy, mental health, I kind of put that all under one umbrella, but have separate stations
Hmm.
in that med spa.
Like
So
a
like
disciplinary space.
having that separate space where you can have PT and massage therapy, but you can also get the help for your mental health, or have an esthetician come in and help in some type of way, some type of shape or form. That is one of the biggest dreams that I want to have once I graduate with my bachelor's. I've said that for years. I've always wanted a med, and people
Great. I
people
love
are
the multidisciplinary approach.
yeah, people are like, "You want a med spa?" And I'm like, "Yeah, I want a med spa." You would never think that. I don't see enough of them here in Texas, and so since I don't
Really?
see, I don't me, I rarely see it. I rarely see them. And so I don't see I see med spas, but I don't see med spas that are initiating what I'm thinking in my head, like PT and MT on one side and mental health and all that on the other side. I don't see that. It's always you see a mental health office, or you see physical therapy, like it's separated. It's not combined. And I want to make that more combined, because that way it helps in multiple ways, instead of you have it separate and you're going to one office
Hmm.
here and then you got to go to another office just to get that help. So I kind of wanted the balance of both of them together,
All in one under one roof.
like all of them under one roof. Which I mean, I don't know if it's call me crazy, but I mean, it's an idea that I have.
I mean, I've seen it work in the chronic pain space,
That's what I'm saying.
all under one roof.
If it can work in one space, I feel like it can work in multiple spaces. In multiple
Yeah,
spaces. And where
multidisciplinary.
People don't feel so alone to just do that physical therapy or that massage therapy, or feel like their mental space is just not helping or it's broken. You don't see, it's just like you don't see a lot of that. And then especially where Black women and young women, young adults, they're not even, right now we're not even getting the help and resources that we need, because everything is getting cut, and it's so scary when during this time where I'm looking at my daughter and I'm like, what is going to happen to her future? So I often think about that a lot with my daughter's future, and how hospitals are going to start closing and clinics are going to start closing, and people are really losing their jobs, behind what's going on. So that's just me, and that's really my biggest takeaway.
Thank you for doing what you're doing. I'm glad you're bringing awareness to all this stuff.
I know it's coming
It's
a
really
lot.
helpful.
You're welcome. I know it's coming out a lot, like I'm spewing a lot with coming out with all of this information to people, but I rather people know what kind of resources and things that they can do now, versus they down the line they don't have the resources or things get cut. I mean, podcasting is huge right now, and if you have a voice, why not share it? That's how I think of things.
Absolutely. Yeah. We do what we can where we can.
Yeah, but I do appreciate you being on this podcast. I would love to learn more, because we have more episodes that we need to talk about. We need to talk about like tears and, sorry to scare people,
Yep. That's a
but
whole episode in itself.
whole episode in itself. Tears, and what else? Learn more yoga, and
Okay. I'm down.
I'm down. I'm down to learn more about PT and,
Let's do it.
getting that balance. It's called the Balance Boss Mom for a reason, people. So
That's right.
where can people find you on this podcast?
You can find me on Instagram
She is awesome on Instagram,
at
y'all. I've been.
balance balanced period Izzy Yoga, PHYSIOGA.
Oh, say one more
That's
time.
where you'll find me.
Off
Come again?
one more time, so that way I didn't cut you off.
Okay. Balance Physio Yoga, PHYSIOGA, with a period in between those two words.
With a period. And
That's my Instagram.
that's her Instagram. I'm
That's my
telling
Instagram handle.
you, her Instagram handle is awesome. And Doctor, if you're listening to this, thank you. I appreciate you and all of the guests you have sent my way, Annie. And I hope you're hearing this too, Annie. Thank you for being on my podcast. And I don't know. I just feel like this podcast is gonna land. It's gonna land somewhere. It's going to land. I have people keep saying it's gonna be big, and I'm just like, not so much. Just take this little by little. But people keep saying it's gonna be big and it's gonna land somewhere. So we'll
Oh,
see.
that's awesome.
Well,
That's
I'm
awesome.
on this podcast this afternoon. Is your baby asleep? Is she asleep? She fell asleep. I made the baby fall asleep. Yes. Oh, wait, hold on. Wait a minute. No, wait.
Every day at 2 o'clock so she can go to sleep. I'll see you tomorrow.
Yeah. No, we should have the podcast all the time at 2 o'clock. Oh, she fell asleep to me. I feel like a winner. Okay, all right. We got to get out of here. So again, I hope you guys take away a lot of things today. I did my first yoga that you're going to see on YouTube, which is going to be kind of crazy. Don't laugh at me and do not judge. We listen and we don't judge. Don't judge the stance.